Testing for allergy, intolerances, and sensitivity. The concept of allergy, intolerances, sensitivity to foods or chemicals or molds can be identified using a number of tests. It's quite popular, it's quite prevalent, particularly with adulteration of foods, as well as poor immune function. About 4.1 million Australians, which is about close to 20% of the population, has had at least one allergic reaction in their life. The immune system produces antibodies which actually attack what is considered a foreign or harmful substance. And that reaction triggers a whole release of histamines, a whole chain reaction, which results in really uncomfortable, sometimes life-threatening symptoms that affect the respiratory system, the gastrointestinal tract, as well as the skin. True allergy are often rare. That is an IgE-mediated response. So type 1 immediate hypersensitivity reactions is what we call an IgE allergic response. IgE antibodies, they're specific for an allergen. They bind onto these immune cells, cause mast cells or basophils, which actually release histamine and cause inflammation. There's a number of ways one can identify and test for allergies, intolerances, and sensitivities. We consider an IgA-mediated response as sensitivity, purely because secretory IgA lives in mucous membranes, whether it is the gut or respiratory tract or the nasal mucosa. IgG refers predominantly to a delayed reaction or intolerance, whereas IgE is predominantly an allergic response. The most severe form of an allergic response would be an anaphylaxis, whereas a milder response might be a skin rash or sneezing. So the immunoglobulin tests can identify a range of foods, ranging from grains to fruits, etc. Grains one can identify and differentiate between gluten and gliadin. In the case of milk, you can identify and differentiate between casein and whey. So can you take dairy products that are, for example, hard cheeses but not tolerate soft cheeses? IgE testing involves looking at about 19 of the most prevalent foods that can contribute to an allergic reaction. Now, most allergies, for example, in an asthma patient or an eczema patient, one might need to identify the underlying triggers. Is there an allergic response or an intolerance or a sensitivity to various inhalants? Could it be grasses or pollens, or could it be molds, or could it even be your household pet or dust mite as well? So this is the advantage of the variety of tests that are available, and you can also measure in various combination profiles. In addition to that, one can also identify LCAT, which is basically antigen leukocyte cellular antibody test. In other words, when that foreign material enters the bloodstream, it causes an allergic response. Your mast cells, your leukocytes are becoming inflamed. They release histamine. That level of inflammation is what we call an LCAT test. One can identify not only a whole bunch of foods, and they come in various cartridges, but they can also identify molds or chemicals or food additives and colors. And one can also have a look at the HLA, DQ, and DR markers. These are genetic markers. HLA, DQ markers are markers of gluten intolerance. So that would be really useful in terms of identifying gene profiling as well. So to determine which test is right for you, please speak with your healthcare professional, or you may contact us to either order a test, interpret your results, or seek guidance on your health condition. To learn more, check out our Learning Centre for in-depth education on this topic. Thank you.